Here's something that should make every employer in America very furious. Your health insurers just invested $1 billion in AI. They're bragging about it on earnings calls. Claims processing that used to take days now happens in seconds. Fraud detection catches overbilling that used to slip through. Prior authorizations that required hours of physician time, they're all being automated. The efficiency revolution has finally arrived, and your premiums are going to hit 9% this year, the highest increase in 15 years. So either AI doesn't actually work or something more interesting is happening. I spent way too long this week digging into carrier financials, lawsuit filings, and some McKinsey frameworks. The story is almost the opposite of what you're hearing. The savings are real, they're just not going where you think. To understand what's happening, you need to understand where healthcare administration costs actually come from. The United States spends roughly $1 trillion a year on healthcare administration. Let that sink in. About a third of all healthcare spending. Private insurers run administrative overhead at 5 times the rate of Medicare. Per transaction, we're talking $12 to $19 per routine claim, $40 to $50 per prior authorization submission. This isn't a technology problem, it's a structural incentive problem. The parties who benefit from administrative complexity, and we're talking carriers, vendors, intermediaries, are not the same parties who pay for it. That would be you. So now enter AI. Healthcare AI spending has nearly tripled since 2024. And the return on investment is real, about $3 back for every dollar spent, with a payback period of just over a year. CMS alone has saved $2 billion using AI to fight Medicare fraud since last spring. That's only a year. Their fraud detection center has suspended another $1.8 billion in payments across 249 providers. These aren't projections. They're audited results, so the technology works. The question isn't whether AI delivers efficiency, it does. The question is, who captures the value? The conventional wisdom goes something like this. AI is transforming healthcare administration, efficiency flows through to everyone, carriers reduce operating costs, providers spend less time on paperwork, and employers who fund this entire system through premiums should see those savings reflected in their renewal quotes. Sounds reasonable. Benefits consultants are excited about it. Carriers include AI efficiency in their marketing materials. McKinsey has published frameworks showing exactly how much value AI creates. If you read the carrier earnings calls, the story holds. United Health CEO describes AI as ushering in a new age of technology for improving their cost structure. HCA projects hundreds of millions in savings for HCA's bottom line, and Humana expects substantial efficiency gains for Humana's operations. Notice the framing. Every single one of those savings projections is positioned as margin improvement for the company that's deploying the AI. Not once, and I looked, has a major carrier announced AI-driven premium reductions for employers. And here's where the story breaks down. McKinsey's framework is instructive here. They break down AI value into 3 buckets for insurers. The first bucket is administrative cost savings, claims automation, prior authorization, call center AI. This is what everyone talks about. It's also the smallest category, maybe 2 to 3% of revenue. The second is medical cost savings from fraud detection and utilization management. This is 2 to 3 times larger than admin savings. And the third bucket, the biggest of all, is what McKinsey calls additional revenue. This is risk adjustment optimization, member retention, and cross-selling. Which means when AI reduces admin costs, those savings represent a fraction of the total value being created. The majority flows to ensure revenue optimization. Carriers aren't just cutting cost, they're using AI to extract more value from the existing system. Meanwhile, and this is almost funny, a Reuters investigation this month documented what they call a bot-to-bot arms race. Hospitals deploy AI to optimize billing codes for higher reimbursement. Insurers deploy AI to deny or downcode those same claims. Blue Cross and Blue Shield found that AI-enabled aggressive hospital coding may add over $2 billion in excess spending. That cost ultimately borne by employers through higher premiums. As the Duke Margolis Institute put it, the notion of bot versus bot essentially creates a situation where no one emerges victorious. Actually, someone does lose. The employer funds the premiums that pay for both sides of that arms race. There's a deeper angle on how insurers are using AI for revenue optimization that I'll put in the Substack for this episode. But the short version is that the efficiency gains are real and they're being systematically retained. Now, reasonable people disagree about the magnitude here, and let me address the counterarguments. The first is timing. AI deployment is still ramping up, give it a few years. But the $13 billion in medical loss ratio rebates paid since 2012 prove that over-retention isn't theoretical, it's routine. Those rebates represent over-collection that regulators caught and they corrected. They don't account for more sophisticated retention mechanisms that operate within the rules. The second counterargument is that carrier margins are thin. Health plan margins are at the lowest they've been in 2 decades. But that creates an even stronger incentive to retain every dollar of efficiency as margin recovery rather than premium reduction. The third argument is that employers should just negotiate harder. Here's where it gets interesting. In fully insured plans, carriers own the data, set the premiums, and retain the surplus. Employers have no visibility into how AI efficiency affects their specific pricing. The carrier has both the information advantage and the financial incentive to retain the savings internally. The proof is in the lawsuits. ProPublica reveals Cigna's PXDX algorithm auto-rejected over 300,000 claims in 2 months, spending an average of 1.2 seconds per claim. One medical director denied 60,000 claims in a single month, a rate that makes individual review physically impossible. First, self-funding becomes more attractive. Self-funded administrative costs run about 45% lower than fully insured. For a 1,000-employee company, that's roughly $850,000 annually in admin savings alone. Plus, you own the data and you can actually see where the money goes. Second, AI-powered claims auditing is now essential. Traditional auditing reviews only the top 1% of high-cost claims. New AI tools can audit 100% of claims in real time, flagging overbilling before the check is actually written. The Consolidated Appropriations Act gives you the legal access to your claims data. If you haven't exercised that right, we'll do it right now. Third, your carrier contracts need AI transparency provisions. Carriers are deploying AI across claims adjudication, utilization management, and prior authorization. You have the fiduciary obligation to understand how those tools affect your plan members. Demand disclosure of what AI systems they are using, audit rights for their denial rates, and specific pass-through clauses for efficiency savings. Fourth, consider direct contracting. GM and Henry Ford Health have achieved 6 consecutive years of shared savings by bypassing insurance entirely. Other value-based arrangements have cut employee medical spending by double digits. The playbook exists. The question is whether you're willing to act on it. So the AI efficiency story isn't wrong, it's just inverted. The conventional narrative is that AI will make healthcare cheaper for everyone. The reality is that AI is making healthcare more profitable for carriers and health systems, while employers continue to subsidize their margin improvement. The savings are being generated, they're just being retained upstream through tighter carrier margins, through revenue optimization algorithms, through pricing opacity, and information asymmetry that allows insurers to capture efficiency gains while raising your premiums 9% in the same year. The employers who understand this will be the ones demanding transparency, deploying their own AI auditing, moving to self-funding, and contracting directly with providers. They'll recapture thousands per family per year that's currently disappearing into carrier operations. Everyone else will keep funding both sides of a bot versus bot arms race, wondering why their premiums never seem to go down. If you found this useful, hit the subscribe button so you don't miss future episodes. The research sources and additional analysis are on my Substack. Links in the description. And until next time, I'll see you then.